Understanding Cushing's Triad. More information can be found in the First Aid for the USMLE Step 1 textbook. The sections include cardiovascular, physiology, components of Cushing reflex, neurology, anatomy and physiology, cerebral perfusion. Welcome to this educational video on Cushing's Triad, also known as the Cushing reflex. Before proceeding, remember that this information is intended solely for educational purposes and should not replace professional medical advice. Always consult a qualified healthcare provider for personalized medical guidance. What is Cushing's Triad? Cushing's Triad consists of three primary signs that indicate an increase in intracranial pressure: decreased respiration, increased blood pressure, and bradycardia. It is the opposite of the signs observed in shock states, where respiration rises, blood pressure drops, and tachycardia occurs. Understanding the mnemonic. To remember the components of Cushing's Triad, let's use the mnemonic brain, brain again, and heart. This will help us associate each sign with its underlying mechanism. Location 1. The brain, respiratory depression. In situations such as head trauma or cerebral edema, elevated intracranial pressure causes physical stress on the blood vessels, leading to arteriolar constriction. This pressure can push the brain and cause herniation, resulting in higher intracranial pressure than mean arterial pressure. Cerebral ischemia occurs as blood cannot enter the brain, affecting the respiratory center located in the brainstem. This mechanical stress on the brainstem leads to slow or agonal breathing, which may progress to respiratory arrest without timely medical intervention. Location 2. The brain again, hypertension. Increased intracranial pressure leads to difficulty in oxygen exchange, resulting in elevated carbon dioxide and proton levels. The central chemoreceptor senses these changes and triggers a sympathetic response to compensate for the elevated intracranial pressure by increasing mean arterial pressure. This compensatory mechanism results in hypertension. Location 3. The heart, bradycardia. The heightened blood pressure triggers the peripheral baroreceptor, which senses the stretch. To counteract the effects of the central chemoreceptor, the peripheral reflex baroreceptor instructs the heart to slow down, leading to bradycardia. Do you remember the equation? Cardiac output equals stroke volume times heart rate? Mnemonic review: brain, brain again, and heart. Location 1. Brain, elevation in intracranial pressure leads to brain herniation and respiratory depression. Location 2. Brain again, the central chemoreceptor causes a sympathetic response leading to hypertension. Location 3. Heart, the peripheral baroreceptor activates the sympathetic response to the heart, causing bradycardia. That concludes our exploration of Cushing's Triad. Always seek professional medical advice for any health concerns and your textbook for cross-referencing. Now, take a break, get some fresh air, and engage in some exercise. Thank you for watching.